In this presentation, we'll introduce the topics of changing health behavior and critically reviewing health information. Appreciating why and how people change health behaviors and learning how to become a skilled consumer of health information will serve you well on your journey to improved sleep. You've probably changed a health behavior in the past, or know someone who has. Most of us have tried to adopt healthier habits at one point or another. Do you know anyone who is trying to start an exercise program, eat better, or stop an unsafe behavior like distracted driving? What makes the difference between simply having a goal to change behavior and actually incorporating that new behavior into our daily lives? What helps us maintain a new healthy habit and resist less healthy ones over time? Take a moment to consider these important questions before we embark on our SleepWell journey. In answering these questions, you probably listed a number of factors that are both within the person trying to change and outside of them. Behavior change theories describe sources of motivation that are both intrinsic, like someone's desire to feel better, and extrinsic, like factors in the environment where the person lives and works. The motivation to change might be based on an individual's perception of the consequences of practicing the current behavior compared to the benefits of adopting a different behavior. For example, the health risks of smoking cigarettes are very serious and occur commonly among smokers. Cigarettes are expensive, and smoking is now banned in many public places, making smoking an inconvenient habit to have. However, because tobacco is also a highly addictive substance, smokers must be convinced that the incentives associated with quitting tobacco are worth the discomfort of quitting. These benefits include both a short-term and lifelong improvement to their health, saving money that would otherwise go towards cigarettes, and avoiding the negative social aspects of not being able to smoke in public. Often students mention that having the support of a friend encourages them to change. A friend could be a partner in making the same behavior change with you, or can set a good example and offer advice for the habit you want to achieve. Having someone to talk to about both the challenges and successes of change can help. Sometimes having a buddy that asks about progress makes us feel accountable for sticking to our goals. Cues to action are external influences that promote the desired behavior. A cue to eat more vegetables could come from a funny advertisement you saw on your smartphone, a recipe sent to you by a family member, a conversation with your doctor, or a new salad bar where you like to get lunch. Sometimes awareness of the negative consequences of an unhealthy behavior prompts us to get serious about making a change. An unexpected event or shocking story could be cues to action, startling us into realizing that a change is needed. We live in a world where we have constant access to a huge variety of health information. Name a health problem and we can quickly find articles and videos on the topic and usually propose solutions with testimonials. And that's just online. Health advice is shared around the clock on television and is a common topic in much of our interactions. There are clear benefits to having access to so much information. Remember the cues to action? But there are also quite a few risks, including wasting time and money, providing misinformation, or even causing harm. Becoming a smart consumer of health information will benefit you throughout this course. In fact, reading and evaluating health information with a dose of skepticism can be a great skill for life. When reading and evaluating any piece of health information, it's generally helpful to understand a few things about the information's authors and sponsors. First, we should consider what or who is the source. You should be able to locate the name of the person or organization who authored the information. Credentials such as degrees earned, affiliations with academic, research, and medical institutions should also be stated. Is it reasonable to assume that the source would be knowledgeable on this topic? Secondly, what is the source's agenda? Are you able to determine the source's perspective? Is it an expert panel that has reviewed a number of options and is reporting on the results of all of them? Is one individual offering an opinion based on their own experience? Does it seem like the author is trying to persuade you to take some action? If so, does their conclusion make sense based on what you know already, or does it seem too good to be true? And of course, it's also important to ask yourself, who is paying for the study? Many studies are funded by organizations that have an interest in their outcome. Did a company that produces or sells a particular product or service pay for the study? If it did, it doesn't necessarily mean that the study's findings are invalid, but this influence is something to keep in mind when interpreting the results. Additionally, it should be noted that not all studies are created equal. Certain types of scientific studies are considered more credible than others. The size and characteristics of the population also matter. If you have taken courses in research methods, for example, you are probably familiar with these and other details that influence the quality of a study. If you have an interest in developing your skills at reviewing and evaluating health information in general, or you want to enhance your ability to interpret health research, you may want to check out the resources listed here. There are many factors that influence our health behaviors, making our health goals easier or more difficult to achieve. Throughout SleepWell, we will consider the various factors in our environment, relationships, and habits that affect our sleep. We will look at why sleep is important, the influence it has on our performance, and specific things we can do to enhance our sleep. This course is intended to provide you with information and suggestions to get the very most out of your sleep for your overall well-being. Not every suggestion will be right for you, and not everything will start working immediately. That's okay. Changing is a process. By signing up for this course, you already may have made the decision to initiate change. Ultimately, to adopt new behaviors that promote enhanced sleep, you'll need to determine how the resources provided here will work best for you. Feel free to consult the expertise of the instructor and health promotion specialists. Feel free to try some tips during our time together and maybe save others for later. Please be a savvy consumer of information on sleep and other health topics, and don't hesitate to question the things that don't make sense to you. You are an expert when it comes to your own sleep, so make this course meaningful for your needs. This concludes the health behavior and health information presentation of SleepWell.